this episode of Africa Health Check.
We need our government to work more about the hospital facilities, the medicine, all of that.
We should put pressure on our leaders so that we can be provided with the proper healthcare services that we need.
We explore the status of universal health coverage in Africa.
When we look at the universal health care, it's important that we have inclusive policies.
And the potential pathways to achieve our UAC goals for all in the continent. Countries that achieve their universal health coverage targets by 2030 would have eliminated preventable maternal and child death, strengthened resilience to public health emergencies, reduced financial hardship linked to illness, and strengthened the foundations for long-term economic growth. On today's episode, we will be discussing Africa's status on achieving universal health coverage and leaving no one behind. I am your host, and I welcome you to Africa Health Check. I am joined by our experts, Dr. Marianne Moreithi, the chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we get into that, let us have a look at this episode's feature story.
My name is Susan Kelechi Homa. I am from Imo State in Nigeria. I'm a polio survivor. I had polio when I was 3 years plus. I'm a gender and social inclusion advocate. I live here in Abuja and I work with Inclusive Friends Association. I'm a graduate of the University of Lagos and I have 2 degrees from the University of Lagos. As a polio survivor, one of our major challenges will be infrastructural barriers. And when we look at infrastructural barriers, our health facilities are not left out. Most of them are not built with persons with physical disability in mind. You find that there are steps, there are no ramps to accommodate someone like me who uses a wheelchair or people with crutches. And so it's quite cumbersome to access healthcare services. And even when you access the healthcare services, sometimes you find out that the facilities on ground cannot even cater for my needs, because sometimes I might need to check my weight. And when you go to the facilities, the weighing scales cannot accommodate my type of disability. So it becomes a huge challenge accessing healthcare here. I had to quickly accept reality. Initially, I was questioning myself. I was in denial if that was true or not. But I had to accept reality because each day we keep hearing people who were dying. So I had to accept that for a while, which I couldn't tell how long it will last. When we look at the universal health care, it's important that we have inclusive policies. When we talk about leaving no one behind, we are looking at policies that mainstream disability. And when I am talking about disability, I'm not only talking about issues of polio survivors, I'm talking about issues that will affect a deaf person who comes to a health facility, a person with Down syndrome, autistic person, and different types, even a person with albinism who is prone to cancer if her skin or his skin is not protected. I'm looking at mainstreaming policies that will accommodate all forms of disability. Remember, disability is not homogeneous and it's not a one-cap-fits-all. So you can't say because you have a ramp at a health facility that the issues of disability has been covered. It's also important that health workers are trained and retrained. And that is very, very important for us as an organization, because we look forward to avenues where we're able to train health workers to understand the peculiar needs of persons with disabilities. Embracing diversity is the new normal. Just like we embraced COVID then, the new normal is to embrace diversity. And there's no way you can embrace diversity without embracing persons with disability. No one prays to have a disability, but when it comes, you just have to accept it. And it's important that policymakers, those in governance, those at the top, at the middle, at the bottom, everyone begins to embrace inclusion. No one is going to silence us. No one is going to make us feel less of ourselves. We have survived polio, we have survived our disabilities, and definitely will conquer our world.
Really, really inspiring. She has definitely given us a lot to ponder on and discuss in the context of universal health coverage. And maybe just to start off with, Reverend, here at Africa Health Check, we prioritize ensuring that we raise awareness, but we also do public education. So maybe just to lay the foundation for this discussion, you could just sort of unpack, what do we mean by UHC and what are the key components?
Universal health care simply implies that every human being has a right to life. And if they have a right to life, then they also have a right to good life, good health. You look at sub-Saharan Africa, our population is basically rural, urban, literate, illiterate. So this advocacy, this platform is a voice for the voiceless, those who cannot be heard, those who cannot be reached. In the hinterlands, the rural areas. In Africa, rural areas means hard to reach, bad roads, no roads, difficult terrains, people who don't understand the official language and no one is translating it for them, so they can't read signs, they can't. And we are saying that if they are human beings, whether they have disabilities or not, whether they are in the cities or in the villages, it doesn't matter. We have to give them good health care. Everyone, rich, poor, whoever it is, rich, poor. To me, that is what basically
UHC means. And maybe just to rope you in, yes. Dr. Marianne, you could just maybe share some of the key components or pillars of UHC.
Yes, so actually just to add on to Reverend's point of what UHC, we had a few years ago where we had this awesome President Obama. And I remember watching in the news, he was introducing what was being called at that time, I think, politics, Obamacare. And Obamacare really was universal health coverage for everyone in the US, rich, poor, disabled or not, rich neighborhood or not, white, black, could access equal medical care, equal medical coverage. And I know that cost him a lot of sleepless nights, because I could switch on CNN, I see both political parties just really against that universal healthcare coverage, Obamacare. I guess it was to do with the name and yes. So back here at home, again, we've been really striving, particularly in my country, to have this UHC rolled out and been practically implemented. Of course, there's a lot of challenges. There's a lot of barriers that prevents that. But what are the pillars? The pillars is to be able to have equal access, not just to medical care, but to other cares in terms of vaccination, in terms of accessing drugs, in terms of accessing nutritional support, in terms of even accessing psychological and mental support. And of course, having all those supplies, commodities being another pillar, having human resource. I mean, we could talk about having all this equipment. In Kenya a few years ago, it was a very good initiative. They had all the equipments donated. Talk about CT scan, MRIs, everything, X-rays were all donated to each and every county, almost to each and every hospital. But someone did not think ahead. Who is going to use these machines? Are the people down there trained? Some machines were taken to the most remote area in Kenya, Turkana, in the southern part. But up to today, those machines have never been used, which is really sad because, yes, you have all that infrastructure, you have the equipment, but they did not train the human resource, the lab technologists, the doctors, to be able to use these machines. So again, that's one of the strongest pillars, apart from the money, infrastructure, the political will, but also train your people, have enough lab technologists, have enough doctors, nurses, pharmacists, community health workers. All those play a very big role to make sure that we are successful when we come to roll out the universal healthcare coverages. And in Kenya, that's a huge example of how not to do it. And we've learned our lessons. And now there are a lot of what we call continuous medical education and also training, not just to equip a hospital, but train the personnel there to be able to serve the population that needs it the most. I can talk more and more about it. Immunization, having the vaccines there, having, disease surveillance, all those things play a key role in making sure that we have a thriving society, a thriving community, that whatever they need is at the tip of their fingers.
Absolutely. The UHC targets are to be realized by the year 2030. Could you maybe highlight some of the key indicators that will be used to measure whether a country has realized the UHC targets? I know sometimes we use measurements such as, the radius to the nearest healthcare post, commodity availability and stuff like that. Maybe you could just share some of those key indicators.
Yes, 2030. I think for me, being an infectious diseases person, we have so many targets for 2030. By 2030, we want to make sure you have a HIV vaccine. By 2030, we should have eliminated malaria. So 2030 keeps buzzing in my mind because everyone has a target for 2030, and UHC is one of them. So some of the key indicators, you're right, is there equitable medical coverage in all the places that we're talking about? What is the distance between the nearest dispensary and the nearest village? And also, when you come into that center, what is the usability of the different drugs? Are they being used? Have vaccines been rolled out? How many children have been vaccinated? How many have not been reached? All those are some of the indicators you're going to be using, some of the key items that you're going to use. How many people have gone for such surgeries? How many people are going abroad to access better healthcare coverage? And can we reduce that, what we call medical tourism? In Kenya, it's a big problem because if you have the money, the elite would fly to London or fly to South Africa or to India. So again, we have those numbers. Have we reduced how many people are seeking medical care out there, and they're actually accessing equal or even better care within the country, within their location? And of course, it's affordable. For me, it should be free because we're paying our taxes. So why is it not free? So all those, again, are some of the indicators we use. And I don't know, for Reverend, what else may I have left out? Because there's so many of them.
Yeah, you are right. Just to add that, I think there are governments, whether they don't have the political will or the conviction that this is a real need, that we need to commit, in terms of priorities. It saddens me. I live in the city of Accra and the outskirts, and traffic, and the places where teaching hospitals where one could be assured of good care in an emergency. So someone is taking ill. Thank God that there are ambulances stationed. But to be able to make it to the nearest place for emergency issues is zero. Why? Because the big hospital is located at one place in a huge city. You go to London, it's not like that. You go to US, New York, any borough, every borough has a major teaching hospital, one or two, for accessibility, nearness to those things. So talking about UHC for all, we can't talk, like you rightly said, we cannot talk about delivering healthcare to people without the practitioners. I think there must be a way by which government can really, really upscale the training of doctors, the training of healthcare specialists, and then make their service conditions such that it doesn't matter whether you work in the city or in the village, you are taken care of.
Get quality health care, absolutely. Thank you very much.
And when the facilities are also available.
Yes, and affordable, accessible to all.
There should be more health centers. That is one, and then those health centers too should have enough equipment. And then their fee, in terms of the bills too, should be reduced. Because we know the situation of things around, people are struggling.
The government does its best. However, I'd say outreach programs by the Ministry of Health would really improve. If we were to have community-based healthcare, and I know that they're there, but the one that they do go door to door to conduct healthcare checks.
The government should look out, waongeze madaktari wengi iwezekanavyo, pia madawa pia iongezewe, ndio upate kama mgonjwa ameletwa, anatibiwa haraka, anapata nafuu, anarudi manyumbani.
You know, I once attended a conference and somebody was giving a presentation and they say, you know, in Africa or in our different countries, we have the hard to reach people or populations. But when you go to those communities, you will find a bottle of soda, you will find political party merchandise. So it means that we are actually able to reach those people. We're just not reaching them with healthcare services. So I want us to dive into that. Who are the people that we're leaving behind and why are we leaving them behind? And what needs to happen to ensure that we leave no one behind? Dr. Marianne.
Yes, so yeah, it's very interesting. You'll go to the most remote area and you'll find a Coca-Cola bottle. Very, very. But then when you go to that remote area, they'll tell you, oh, I've not seen a newborns, I've not received a BCG vaccine. I'm like, okay, so what is the problem there? Is it supply chain? Is it the vaccines are not getting to you at the right time? We don't have the infrastructure to transport? So there are many questions that we may raise from there. So governance is key. Are they, first of all, what we need to do with the governance is to tackle the big monster that I think most African countries have been tackling with, and that's corruption. We have a lot of goodwill. Like in Kenya, for example, again, we have what we're calling NHIF, that is National Health Insurance Fund. So for people who are employed, you pay quite a bit of money from your salary to the government so that they can then roll out this equitable healthcare coverage. But then again, for us, yes, we a big chunk comes from our salaries, but are we feeling that chunk when we go to the hospital or the person at the most remote area? I know some of my salaries meeting her or his medical needs, but yet again, they're lacking some of this. So what's the barrier there? Where is my money going? And so again, first of all, we need to just have all those checks and balances that we're all, and I'm sure many other African countries have such a fund. So when we remove that money, where is it going? Is it building new hospitals? Is it equipping these hospitals, this personnel with equipment? Is it then having that cold chain? Because we need a cold chain to be able to transport vaccines or some very sensitive medications from maybe the warehouses here in Nairobi to the most remote areas. So where is my money going? So we need a very good accountability system. Then again, allow me to talk about supply chain. We have a lot of goodwill, not just within Kenya, but our donors. We have USAID being our very big donor, Africa CDC, MasterCard Foundation. They've joined hands and they're supplying us with a lot of commodities, one of them being the mosquito nets. So from the books from our donors, they donated mosquito nets and other very precious commodities, almost over $1 million. But then when they did their checks and balances, some communities have never seen those materials. malaria cases are going up. So it was a very big scandal where, again, government officials were implicated. This money was given, these commodities were given. They were found in a warehouse somewhere, ready maybe to be used or ready to be sold for profit. And that, again, we need to have very good barriers or a gate that protects the most vulnerable from such misuse of funds, misuse of equipment, life-saving equipment or medication that has been either locked in a warehouse or expired in a warehouse because someone else has other thoughts. So again, for me, in terms of governance, I'd like all those loopholes to be sealed. Others, again, is education. I keep talking about awareness. Again, for these remote areas, this person may want to go see a local healer. The local healer may maybe prescribe something that will probably prolong this person's suffering and may need some medical intervention. So what are we doing again in terms of awareness? Are we using our community health workers? Are we using peer leaders, the gatekeepers in communities? Again, those are very key for us to be able to implement the universal healthcare coverage and also to have that check and balance. Allow me to give you an example of children in one of the most remote areas in Kenya. There's a donation of parasequental. That is a very essential drug that controls swarms and other gastrointestinal complications that these children have been suffering from, and it's rolled out in primary schools, in also in kindergartens. When we went to check if these kids had received the drugs, they hadn't. The headmasters, the heads of schools had not even seen those drugs. But on the books, it had been ticked that, again, it had been delivered. And so, again, we ended up scratching our heads. Where did those drugs go? Where did those funds go? So there's a lot of examples.
It's a huge concern, actually, because many times we're talking about how we need more support, more funding. But, interestingly, when you look at a lot of reports, when it comes to financing in Africa, you realize that Africa actually loses more money to corruption than even the total that we receive in aid. And this essentially means that, without corruption, we wouldn't even need aid from external sources. So I think the governance aspect, and I know that you're going to weigh in, Reverend, because you're extremely passionate about issues of leadership and accountability.
The fear and the scare is if you're in the medical field, healthcare delivery comes with a high cost. It's very expensive. And for most of our people, if you don't work, if you're a child, if you're aged, elderly, if you have some disabilities, the tendency is to ignore. After all, you are not productive. You are not bringing anything in. But that is wrong. That is why the emphasis on universal healthcare. And you rightly talked about the NHIF in Kenya. We have the NHIS in Ghana. And there is such a sharp contrast, between when we're doing the cash and carry, you pay, you get the care with maternal health, and child care in Ghana. When it was introduced in 2013, the NHIS, there was a sharp contrast how many mothers were kept alive because it was free through the NHIS. So I think with such good reports, even international bodies, NGOs are willing to donate, they are willing to come in and support the drive. Only if our leaders, political leaders, will have the backbone to make UHC a priority. Because if you have a healthy nation, you have good people that are working, you have good people that are bringing in whatever you boosting the economy. So we shoot ourselves in the foot by neglecting it, by not attending to the concept of UHC. So it is good governance, but prioritizing that this is a needed area. We can't afford to have sick workers, sick people more importantly, children whose future we don't know, to be neglected. Even disabled people like this lady, look at how articulate, how intelligent she is, all because her parents never, sideline her.
You said something that has triggered a thought of in my mind. We have what we call Linda Mama initiative in Kenya, where Linda Mama means protect the mother. And this has been rolled out in all counties in Kenya. So Kenya, we have a devolved government. And in these devolved counties, in each county, there's a major hospital, referral hospital. And then we have this program saying, we call Protect the Mother. So in this program, we make sure that any woman who comes to delivery will have a healthy outcome, both for her and her baby. And a lot of infrastructure, finances has been poured to that so that each mother has equal access to have a safe delivery. They will not bleed to death. They don't need to be transported to very far distances. And also, most importantly, they can afford. They can afford the care, access the best gynecologist, the best pediatrician through that Linda Mama initiative. And it's working in Kenya. So for me, I just want to see more concentrated efforts, concerted efforts, having all the
More deliberate and intentional efforts.
Exactly.
Absolutely.
Yes.
And I think governance is definitely a big issue. When it comes to matters of corruption and in the health sector, it's not merely an economic crime, it's actually lives that could be lost as a result of that. So I think the call to action here is that we all have a role to play by educating yourself as an individual about what is UHC and what are the targets for 2030, by raising awareness, but also by playing that pivotal role of holding leaders accountable as well. That pivotal role of ensuring that you are actually being an agent of change, even in your community. What are you doing about it? I've seen a lot of celebrities of recent building hospitals, clinics in their communities, and I think that is really incredible. And it shows that achieving some of these global commitment is not a one stakeholder responsibility, but all of us in our different spheres of influence can definitely contribute to the ultimate achievement of the UHC outcomes. So thank you very much for that. Before we wrap up the show today, I would like us to take a look at our African health champion for this episode. She's a professor in microbiology at Dakar University in Senegal. Let's have a look.
From Senegal, Professor N. Kumba Toure Kane stands as a beacon of Africa health leadership. An accomplished doctor of pharmacy, PhD, and microbiology professor at Dakar University, she's dedicated her career to battling infectious diseases. Her pioneering work in HIV's molecular epidemiology and drug resistance has left an indelible mark. She's introduced innovative tools like DBS for HIV monitoring, transforming patient care. Her efforts have scaled up viral load and early infant diagnosis access across multiple nations, epitomizing her dedication to equitable healthcare.
Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. The handle is at Africa Health Check. Until we meet again, same time, same place, same day, remember the future is Africa, the future is today.